Hi everyone, I'm Dr. Sivasubramaniam, consultant medical oncologist and radiation oncologist at Sundaram Medical Foundation, Anna Nagar. So breast cancer, how does it manifest? It's just any new lump which is seen in breast or palpable in breast, especially in postmenopausal women. So postmenopausal women, if they see any new lump in their breast, it should be notified immediately because the incidence of breast cancer is very high in postmenopausal women. So the other symptoms which they can see in breast cancer are any change in color of skin or just orange peel like appearance of skin over the breast, or any enlargement in the axilla, which is the draining part of breast, or there can be any nipple retraction or any ulcer over breast. So these are the common symptoms. Most important thing among all is we should not wait for pain to occur. The moment we get pain, it means the lump is advanced. So everybody should be cautious that even if the lump is painless, they report to the clinician first and see what it is. First thing they do is the mammogram, followed by clinical examination as well as biopsy to confirm the same. So next is uterine cancer. So uterine cancer is medically called endometrial cancer. Any postmenopausal women, if they come across any bleeding or spotting per vagina, they should immediately report to the doctor because it can be an early symptom of uterine cancer. We can pick up early disease because as the female sees blood in her vagina, especially postmenopausal women, it can be tested by dilatation and curettage, or it can be done by a pipette testing and thereby diagnosing early in stage 1 itself. The treatment will be surgery, that is removing the uterus. So next is cervical cancer, which is the lower part of uterus. So any cervical cancer we have to suspect whenever female is having any abnormal discharge per vagina, that is foul smelling white discharge, or whenever they have bleeding per vagina, especially after coitus, or any low back ache, that can be a symptom of this cervical cancer, or they may be having bleeding per vagina. Even though bleeding is rare, sometimes it can occur. So any of these symptoms, the women or female should report to the doctor. It can be either gynecologist or the family doctor, and they have to be examined by the gynecologist in the OPD and be inspected on speculum examination. If there is any growth, they have to be ruled out by biopsy. Biopsy is a procedure where small tissue is taken and it is tested under microscope to confirm whether it is really a cancer. Next is ovarian cancer. Ovarian cancer is very difficult to diagnose. Why? Because the moment they present to the clinic, it will be very, very advanced. Early ovarian cancer is usually asymptomatic. So ovarian cancer of two types, main types, that is epithelial and germ cell tumor. This germ cell tumor is a very, very rare entity. It presents in young women, that is less than 30 years of age group. They usually present early because they will have a pain in their abdomen and they present to emergency department early. Whereas most common ovarian cancer is epithelial ovarian cancer. Early stage will never have pain, they will have just blotting sensation, or they will be having dysphagia or dyspepsia, or the moment they eat something they will have fullness in their stomach. So all these symptoms can be due to ovarian cancer. First site to spread is peritoneum, that is abdomen. So the moment it gets spread to the peritoneum or some fluid is accumulated, it means the disease is at least stage 3, that is locally advanced. So ovarian cancer is very, very difficult to diagnose. Every physician should be alert that it can be a ovarian cancer. Simple test is ultrasound, that will give lot of investigation. So any symptom, if patient attributes to abdomen, we have to correlate with ultrasound, which is a very simple. They don't have any radiation exposure. Even the pregnant women can get tested. So it is a very cheap and best investigation. So by this we can early diagnose ovarian cancer as well as treat the ovarian cancer.